Thank you very much indeed. It's an honor to deliver this memorial lecture at the close of this meeting in Odessa. And I just begin by saying, as we all know, that the last century has seen unprecedented progress in health and human development. And just to illustrate this, the number of people living in extreme poverty fell from 50% in the 1980s, when many of us were alive, to under 10% today. Similarly, life expectancy has increased more in the last 50 years than in the previous 2,000 years. And finally, take things like childhood deaths, maternal mortality, and malaria. They have halved since 1990, a period that's very close in the memory of many of us. And it's clear that the magic quintet of improved nutrition, sanitation, living standards, vaccines, and antibiotics have caused most of these extraordinary health gains. But conversely, it also means that many of the health challenges before us have fewer simple solutions and are far more complex and multidimensional in causation. And for the first time in history, we really have an opportunity to turn our focus from a life that's nasty, brutish, and short, from disease and early death, towards wellness and longevity. And this is certainly reflected in the aspirations of many of our new World Bank health projects that typically include aims such as aging, longevity, wellness. And yet, if we look at the components of our programs, they typically include hospital reform, integrated patient management, or provider incentives. In short, our interventions are almost entirely in the health sector, but the determinants of long and healthy lives are almost entirely outside the health sector. There's a profound mismatch. We're also living through a profound paradox. If things are so good, why do so many of us feel so apprehensive about the state of the world? And I think that paradox is at the heart of what we need to look at together. And I want to be clear, I don't mean to paint a dark or dystopic view of the future. On the contrary, but I can think of at least 4 reasons why we have this paradox and we're concerned, despite the many positive trends that we see. And first, it's worth underscoring, we have seen health declines in different countries facing different stresses. And nobody over 40 here in Ukraine can forget the economic and health consequences of the end of the Soviet Union, when male life expectancy fell by over a decade. And let's remind ourselves, it's still lower today than it was in 1987. Life expectancy here in Odessa today is shorter than 1987. Similarly, I now work in the US, and life expectancy in the US has declined for the first time in recorded history, and it's declined for 3 consecutive years. And those declines have been fueled by the opioid epidemics, by alcohol, by suicide, and by heart disease. In short, conditions of despair. Similarly, we're now seeing declines in life expectancy in post-industrial areas in the United Kingdom. And I think with their openness to rapid technological and social change, the Anglosphere countries may well be the canaries in the coal mine of the technological revolution. And it's worth underscoring that those who are excluded face multiple overlapping syndemics of deprivation and mental and physical illness. And just consider that severe mental illness is associated with double the risk of heart disease and triple the risk of respiratory deaths. And drug users typically die a full 2 decades before their peers, a full 2 decades earlier. The second reason I think there's so much concern is we're very likely to emerge from this current technological revolution more prosperous. But such revolutions are still wrenching. And it's worth reminding ourselves that the previous industrial revolution led to unprecedented and to exponential economic growth, but at the time, living standards halved. The third reason I think there's so much concern is averages conceal tails. And globally, we're richer than we've ever been, and yet we're seeing rapidly rising inequality, with most wealth gains accruing to the wealthiest, and with wage compression, casualization, and job insecurity increasingly common for less skilled and increasingly for skilled workers. And in tandem, we've seen declining social and income mobility. Income mobility rose progressively from the end of the World War to 1975, and then it stagnated, and it has declined since then. And I know of no more powerful way of illustrating this than turning your attention to the recent OECD report on the broken stepladder to social and economic equality. And what they do is they ask, how long will it take a society to enable its poorest 10% to reach the median, the middle of their economic level? And the answer is as follows. In Denmark, it's 2 years. In the rest of Scandinavia, in Denmark, it's 2 generations. In the rest of Scandinavia, it's 3 generations. In Australasia and Japan, it's 4 generations. In the United Kingdom and Ireland, 5. France and Germany, 6. India and China, 7. Brazil and South Africa, 9. And Colombia, 11. It would take 11 full generations for a Colombian in the lowest 10% of their income level to reach median levels. And what that really underscores is how much the staircase to social equality has stalled since 1975. And it's hard not to link it to the rise in tensions that we see in so many spheres of modern life. And finally, as Robert Putnam argues in his marvelous book, Our Kids, most post-war children in the West, many of us, lived lives far better than our parents. And yet, there's deep unease and some evidence that our kids may have diminishing prospects. So I think those 4 factors account for the fact that there's so much apprehension in an era of greater wealth and technological progress. So I'd like to ask ourselves, what are the determinants of a long and healthy life? And I would offer this simple definition in a nutshell. Good diet and exercise, ideally done with others, a network of family and friends, a stable valued job, a home, and a sense of meaning or purpose. And if you accept that definition with me, let's explore how each of these factors is being influenced. And this conference has had so many good examples relating to diet and exercise, so I'll be brief here. But we all know how much they've been undermined globally by the loss of meal cultures and by the fast food industry. And we've now seen this move through society after society, through Latin America like a torch, into Africa and into Asia. And it's just the case that fast food is far more convenient and far cheaper than proper self-prepared food. And consider how much exercise is undermined by a myriad of factors, by a decline in urban environments, by an increase in physically strenuous, multiple, exhausting, but not necessarily healthy jobs. And the point I most want to underscore today, and worst of all, poor diet and poor exercise, overnutrition and under-exercise are intimately associated with lower education, lower socioeconomic status, lower opportunity. They are concentrated in the poorest communities. And the social geography of illness is the social geography of deprivation, post-industrial cities and forgotten rural areas. Let's turn to family and friends, and we all know how important they are for our health. But increasingly, a growth in social isolation bodes poorly for our health. 2 decades ago, Robert Putnam, who I've already cited, presciently charted how America's social networks, its social capital, in a phrase that he coined, had already eroded, prefiguring many of the reversals we see more starkly today. And in his powerful analogy, whereas post-war Americans joined bowling leagues and other social affinity groups, by the 1990s, in his phrase, they were bowling alone as membership of affinity groups plummeted. Putnam was clear about the cause, television, and he finds the internet and its virtual reality helmets, as he calls them, far more foreboding. And I recently witnessed this, living in the US for work purposes, across our street, as a very elderly US veteran became terminally ill. His Japanese wife had died a decade earlier, and he had few family. But he was a lifelong bowler, and during the last 2 weeks of his life, his bowling friends were seldom away from the house, and after his death, they spent 2 weeks finalizing and clearing his estate. He was in his 90s. It's hard to see that being reproduced in younger generations. And if we share Robert Putnam's conviction that television has displaced social capital, how much more powerful are the internet and the social media that we face today? How much more isolating are the worlds that they are building? How well have we understood their effects on young people before exposing them to them with virtually no guidance, and before we've understood their true impact? I'd like to turn briefly to the relationship between stable valued jobs and wellness. And the link between unemployment and mental health is very well documented. And we all know that the technological revolution first destroyed blue-collar jobs and is now rapidly destroying white-collar jobs. And there's really no better way of illustrating this than by looking at the largest US company 20 years ago, AT&T, which employed over 400,000 people. Google today, 10 times as large, employs less than 40,000 people. So wealth creation and job creation are no longer linked. And we're on the fringes of Western Europe here. Turn our attention to Southern Europe. And a whole generation of young people in countries such as Spain, Portugal, and Greece will grow up without ever working, with youth unemployment in Spain and Greece peaking at 50%, and the jobs that are available increasingly being casualized. And take Australia. A third of jobs in Australia are now casualized. And if there's one statistic I would cite to anybody to understand the convulsions in the US today, it's this statistic. The share of the US economy that's paid in wages is lower than it's ever been since measurement began. The share of the US economy that's paid in wages is the lowest it's ever been since recording occurred, which means there's tremendous wealth creation and it's not being shared through wages. And if we were to turn to a home and home ownership, take one statistic. Among people in the UK, aged 25 to 35, home ownership has fallen from 66% 20 years ago to 25% today. And having cited all these rather dystopian statistics, let me now turn to ask, what can we do? What can we do as communities, as cities, and as countries? And I want to begin with a homage to the health sector. And I want to be clear, there's a tremendous amount that the health sector can do to address these social challenges. Just take heart disease in the US. In the face of an epidemic of obesity and inequality in the US, heart deaths have still fallen by 75%, largely as a result of tobacco cessation and emergency hospital care. And look how much better countries in Europe and elsewhere now manage diabetes. So we want to be clear, the health sector has a vital role to play, and I don't mean to diminish it in any way. I also believe that scientific discovery, Bill Gates' great river of science, is going to give us better and better tools to address conditions, whether obesity, mental health, etc. But my focus today is on the social determinants. And I'd just like to turn to what we can do together, as this meeting has already done, to try and influence some of the challenges. And diet and exercise have been beautifully dealt with at this meeting. Getting on top of the fast food industry, one way or the other. Creating healthy cities and clean air. Critically important, but immensely difficult in many of the mega cities that we see globally. But I'd like to turn to what may be one of the most powerful interventions we have to improve health, and that's social equality. And the simple point is that more equal societies do better on virtually every measure of human progress. Many of those are in Europe. And Europe has 10% of global population, and yet it accounts for 2/3 of social spending. Now, this concerted social spending has allowed Europe to achieve much greater social equality, but it does require immensely high skills and productivity to sustain. So strong skills, strong institutions, strong macro-fiscal policies are essential if Europe is to redistribute its wealth as it does through social spending. And it's clear from what I'm saying that skills are the handmaiden of equality. But here, I mean skills for the many, not skills for the few. And the US and the UK do badly on this measure compared to Germany and many European countries. And in the US and the UK today, limited access to quality education is creating opportunity hoarding, where the children of the privileged will have opportunities that others can never access. So what can we do collectively to try to move towards greater equality? And here I also cite a marvelous series of OECD studies. The first thing we can do is provide universal health coverage so that illness doesn't drive families into poverty. Second, we need to invest in high-quality education for all, I emphasize, not just for the affluent. And we have to minimize school dropouts, which contribute so significantly to differential skills and employment opportunities. Thirdly, we've got to facilitate work participation for parents through high-quality childcare and high-quality early development programs, and increase equality of opportunity through more redistributive progressive tax policies. And then finally, something that I think is really relevant to this meeting, aggressively focus on spatial and regional disparities with cohesion funds, with coordinated development planning, and with inclusionary zoning policies. Take the value of work. There's no question in my mind that the German world, and indeed Australasia, do far better than the US and the UK in valuing all work, including manual and technical work. But nonetheless, the Industrial Revolution is going to continue to destroy jobs, and we're not going to have traditional employment as a source of self-worth in the ways that we've understood. We have to adapt to this, whether through flexible work, by recognizing and rewarding community services work, expanding social and care work, and moving towards a minimum basic assured income to ameliorate the technological change that's undoubtedly upon us. Let me turn to a difficult area, strengthening family and social support networks. Now, I don't pretend to know what to do or what we should do here, but I do know that, for example, countries such as France, which have very good free childcare and easy opportunities for women to return to the workforce, have fertility levels high above replacement, while countries like Germany, which have greater barriers in these areas, do not. And there's surely something to commend in an approach that allows women both to have children and to return effortlessly to the workplace knowing they're being cared for. But when it comes to caring for the aged, it's much harder. Singapore, always a laboratory for social engineering, provides tax incentives for children to live near their parents, the assumption being that they will care for them. And the economic assumption is certainly that children will care first. But we have no evidence whether this is working or not. So let me, in conclusion, say that, as I said at the outset, I'm immensely confident that the great river of science will continue to deliver greater health and greater prosperity. What I am concerned about is this technological and scientific revolution that we're all living through will ultimately bring immense benefits. But our ability socially and institutionally to respond to the wrenching changes that they're creating may not keep pace. And the question isn't whether we should embrace technological change, but how we ensure that our social policies, our educational policies, our institutions keep pace. And I am slightly pessimistic here that so many of our forces, whether political or financial, prioritize short-term horizons and immediate challenges. It's very difficult to find political bodies that can look beyond the short term to look at questions like these in today's world. And I'm also concerned because many of these challenges are also leading to deep anger, polarization, and populism, which makes it even harder to look beyond them to what we need to do. And finally, I think we all have a deep-seated tendency to fight the last war, not the present and future wars. And I think to some extent our social policy is still doing that. So my question in closing is, how well will we collectively manage the technological revolution that we're all living through? Thank you very much.